Right here, right now.
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 Since this program started in here, in my cell, we have achieved a lot.
First of all, when it came in place, we are able to train the peers in the division, that is the Central Division and the North Division. Those peers do help us to do the mobilization and sensitization of the youth so that they can be able to access the sexual reproductive health services. Then after training those peers, there was increased awareness creation among the youth. You know, most of our youth are not aware of the services that are happening to our facilities, especially the sexual reproductive health services.
Before, we had an issue of young people reaching to health workers because most of them were elderly, that these youth or young people would not feel free to open up and give their issues and mind.
Because many people out there, yes, they are old, but they do not have a lot of information about menstrual hygiene, menstrual health, drug abuse. You can find people of years and over, but they are still using drug abuse.
Mu biseera bye najoiningiramu right here, right now, nali sobola kuyimirira mu bantu n'enjogera. Naye kati nafunye obuvumu nti nsobola okwogera n'abantu oba abaana ba ssomero ne mbasomesa. Eyo gye najja omwana eyali yava mu ssomero omuwala lwa bintu ebitategerekeka n'avaayo bulungi, kati yazze mu ssomero n'essaawa zino ali mu senior 4 ali kusomera asoma.
The perspective of learners and members of staff has changed because information is available everywhere. Our people can now make correct choices. They can express themselves freely when they have a problem. They can share within the group. They can share with the teachers. Unlike before, where someone would get a problem and they do not know where to report, or they have no information about what is affecting them.
Before I had joined the Rau Club, I had bad peer groups. But as per now, I left all those bad peer groups. And it was by results of gaining self-decision making.
So Reaching Hand Uganda has taught me to live a life of being hardworking, to live a life of being free from the external pressure that may come all the way. First, being concerned with education first, being concerned with hand skills and more.
However, there are some challenges that I have encountered through the activity that I've been publishing to the community. There is a concept of saying all peer educators are living HIV positive, but this is not true anyhow. It is not true in any area. A peer educator is someone who is there to resemble the fellow. A peer educator is someone who is able to identify something that may challenge a community in terms of delivering a service to a fellow.
Omurundi ogundi tusiima program ya right here right now habukuba izire nesagika ebyoto ebitali bimu na bimu habwensonga ngo nurura hasazino kasumikano ensinganto zona bali focused baine bahindwire bitekerezo byabo kandi entekereza kisana nko kwenyime bayirere icyo kurura hano mu center henyine mu yadi tuna abana bali kusoma tuna ebyalani tuna one bintu ebire na hair dressing kind of which reach a hand ekajatera ho mukono oguma haligo kutusage ko ngo abana bano bayege bisoke kana sazino bali mu basoma batekaine kurungi nitusima program egyo hakuba izire nesagika kandi ekoro muri mu murungi ombukama bwato.
Secondly, the information that I've attained through the Right Here Right Now project, it has enabled me to reduce the stigma in the community, where people are stigmatized, people with sexually transmitted infections, reaching out to a health center or even the parents. First thing they think of is that this person has been sexually active or this person is spoiled. but right now at least the stigma is reducing, and there's a significant change even in the health-seeking behaviors. The young people have got the safe spaces in the health centers where they can go and access information, where they can go and access the health services.
I think that the skills that we have gained from the project will benefit the community even when the project has ended, in the way that someone said that knowledge is wealth. We have been trained, we have been given a skill of making sanitary pads. I don't think that when the project ends, these skills will also vanish from our heads. I know that the skills will remain in our heads, and we are going to remain making reusable sanitary pads, which is going to benefit our community.
So with that knowledge, I decided to start up a business which would help other learning colleagues, I mean the students pursuing law, because it was really difficult for them to attain these legal statutes that I deal in. It was really difficult, but because of the knowledge I picked from Richer Hand, I decided to start it up and help the colleagues.
Because the project is ending and we feel like we should continue with the initiative, we should continue changing our community. So we look forward to establishing a SACCO. This SACCO, first of all, will help us to continue doing our work of advocating for change among youths and older people. It will also help us as youths not to be stuck with life even when the funding is no more, in that we can continue with life through this SACCO, because we can get loans from our SACCO and set up businesses. We can also get other people to join the SACCO. In that way, we as the peers, we shall be gaining and we shall be helping the community.
The message that I have to the young people: to engage in counseling programs, to engage in groups whereby in those groups are headed by the elders, so they can be able to talk to them, and they should be open. They shouldn't keep anything. They should be open to them. They talk to them. They speak out their problems so it can be heard and so that they can be counseled and helped.
As a district, we really appreciate your services to the district that have really improved the health services, especially on adolescent health.
At least as this project is closing, let all the stakeholders make sure that all these activities, they are energized and keep moving. Let everyone play their role in ensuring that the young people access the sexual reproductive health information and rights that they need and deserve.
We are glad to have worked with the district local governments, the national level entities, inclusive of the parliament, that have fronted discussions and debates in line with HIV prevalence amongst young people. And we are hopeful to see more policies and laws enacted in place that are more progressive and more cognizant of the needs of the young people in the region. We are glad to have worked with the Richer Hand team through the peer structures, but mainly glad to have worked under Right Here, Right Now consortium and an advocacy program that is at the heart of the young people in advancing sexual reproductive health and rights.
Right here, right now.